Shall we begin, sir?
Yes.
Thank you, sir.
Learning is an ornament in prosperity, a refuge in adversity, and a provision in old age. Good evening, everyone. Welcome to SAMSIDDHI 2021 International Web Conference Series conducted by Ayurveda College, Coimbatore, powered by DIKSHA E-Learning. In today's session, we will be discussing about pain management through Ayurveda by Dr. Shrikant PH.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class sessions, please use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be posted in the chat box. Question stays will be cleared at the end of the session.
Now, to render the welcome address, I would like to invite Dr. S.N. Suresh, Professor and HOD, Department of Prasudi Tantra and Stri Roga, Ayurveda College, Coimbatore. Over to you, sir.
Good evening, everybody. Am I audible?
Yes, sir, you're audible.
On behalf of Ayurveda College, Coimbatore and DIKSHA E-Learning, it's my privilege to welcome our elegant guest speaker, Dr. Shrikant, who is an Associate Dean of PG and PhD Studies from SDM Ayurveda College, Udupi. As you know, pain is the one which brings the patients to the doctor. If they don't have pain, they'll be reluctant to come to the doctor. And it's the ability of the doctor to manage pain is very important in the day-to-day practice. And we have our speaker, Dr. Shrikant, who is going to share with us his experience on pain management, which is very vital for us in our day-to-day practice. I extend a warm word of welcome to you, sir, for accepting our invitation and for being with us today. We are delighted to listen to your words, sir. And let me proudly welcome all of the dignitaries, practitioners, students all around the globe who have joined with us today. Hope you all get immense knowledge and inspired well enough to spread the Ayurveda globally in this pandemic situation. Welcome you, sir. Welcome you once again. Thank you.
Yes, sir.
Thank you, sir. Before starting the session, let me take this time to introduce our guest speaker, Dr. Shrikant PH. Sir completed PAMS from SDM College of Ayurveda, Udupi, and MD in Basic Principles from IPGT and RA, Gujarat Ayurveda University, Jamnagar. Formerly, he worked at Munyal Institute of Ayurveda Medical Sciences, Manipal, and worked in Parshinikadavu Ayurveda Medical College, Kannur. Afterwards, he worked in Alma Mater, SDM College of Ayurveda, Udupi. Presently, he is working as Associate PG and PhD Studies, SDM College of Ayurveda and Hospital, Pittapadi, Udupi, Karnataka. He has co-authored 2 books, Sajitra Charaka Samhita and the textbook of Padartha Vijnana, and was invited as a resource person in various national and international seminars and was the keynote speaker. We are extremely obliged to have you here, sir. Now, I would like to hand over the session to Dr. Shrikant PH. Over to you, sir.
Thank you. First of all, I would like to thank DIKSHA E-Learning for considering me for this international webinar as a resource person. Thanks to Dr. Srividya and Dr. Drashya, who are in constant touch with me regarding this particular program. Before beginning this lecture, I would like to bow to my guru, Professor Dr. Rambabu Dwivedi and Dr. B. Ravishankar sir, and also my mentor at SDMCA Udupi, Dr. Niranjan Rao sir, with the due respect to all of them, I would like to begin my session. I would like to share the screen. Is it visible?
Yes, sir, it is visible, sir.
Visible, right?
Yes, sir, visible, sir.
Okay, right. So I have been given the topic pain management through Ayurveda. So pain is a problem. Every individual is suffering. In day-to-day life, the person will have pain in one or the other way, in one or the other part of the body, which gives sometimes severe distress to the individual, affecting his daily routine sometimes. Sometimes the pain will be so mild that the person will be neglecting that, not giving a concentration to that particular pain. And sometimes what happens with that particular mild pain, if not attended to, then that will be leading to severe pain at one or the other stages. So we should not ignore even a mild pain sometimes. So that pain, though it is mild, may have some serious disease which is underlying. So we have got different types of treatment modalities in the modern fraternity. So what we can do being in Ayurvedic field, how we can manage the pain. So what is actually the pain? So in this particular talk, I don't want to go into detail with the modern aspect, and nor I will be going into detail with the yogas. I would like to stress on the fundamentals or the principles, the treatment principles by which the pain can be managed. As Acharya Charaka has told in the 30th chapter, there is no rule that whatever that has been told in the Samhitas, a physician should abide by that. That means whatever the yogas that are explained in the Charaka Samhita, he should follow all of them. No. He had given full liberty that a physician can either add any of the dravya to a particular yoga, or he can remove any dravya from a particular yoga depending upon the condition of the disease, depending upon the stage of the disease, depending upon the bala of the patient, maybe sharirika bala or it may be the manasika bala. So it always depends. It is not that he should use the yoga that has been told there. If you want to add few more drugs to a particular yoga, so you have diagnosed the disease, you have selected some yoga, and at one stage of your treatment, you think that your yoga needs some change in the formula. You want to add few more drugs to that particular yoga, thinking that that addition will help the patient more, or the patient will be relieved of his complaint earlier, or you can remove few drugs so that the patient gains maximum benefit in minimum short of time. So such liberty has been given by our acharyas. So I would like to go into detail only through the principles and not on the yogas that are explained there. So what is yoga? Sorry, what is pain? So it's a distressing feeling experienced by an individual. That feeling often caused by an intense or damaging stimuli. It may be a prick, it may be a burn, or it may be any other stimuli. The patient will be feeling the pain. So what is in Ayurveda it is called? It is nothing but ruja or vedana. See, the word vedana is derived from the root word veda, with, which is the root word for the Veda also. So Veda means what? The knowledge. With means to know. So what is Vedana? The pain. Pain is also a knowledge. The person who comes across with any unwanted experience, it may be kandu, itching, it may be burning sensation, daha, it may be the dull aching pain, ruja, or pricking type of pain, toda. They are all nothing but the knowledge. The person will be knowing that something unwanted is happening in his body. So Vedana is also a knowledge. But we have got in Ayurveda, that is Yogika Shabda or the Rudha Shabda. So by tradition, the Vedana means pain. Otherwise, Vedana is also a knowledge. So when we go through the Ayurvedic dictionaries, Ruja is also called as Himsa or Pida or Banga. That means nothing but it's a variety or a sort of discomfort. The patient is not feeling well. The patient is having some kind of distress, some sort of discomfort. So that is pain or Ruja. Again, the pain may be classified as per the modern that it is acute or chronic. Even we have got, sometimes the pain will be occurring very quickly. Sometimes the pain occurs very slowly. The patient complains of pain. It's a gradual pain. So that pain may be due to either any injury like Bahya Abhigata by external sources like the person falling down, getting injured, or he is hit by some sharp instruments or a weapon or the stone or any other substances hitting the body of the person will definitely lead to pain. Or else it may be marmabhigata, any injury to the marmas, the vital organs. Again, if you go through the classics, marmabhigata can occur either due to external factor or it can be even due to internal factor. Something like that of the Nija and Anand. So Ruja is always because of the Vata doshas. Everybody knows we have got the three doshas, Vata, Pitta, Kapha. Any pain in the Sharira is because of Vata. If a person complains of pain, so we have to think of the involvement of the Vata dosha. If he complains of Daha, then we should think of the Pitta dosha, and if he complains of Kandu, then we should think of the Kapha. So Sushruta has told, Nahi Vata Drite Ruja. So even there is no any other conditions wherein other than Vata, the patient will be complaining of the pain. Even the burning pain, though there is involvement of Pitta, there will be involvement of Vata, so along with the Pitta dosha. So in different doshic conditions also, if the patient complains of pain, so in case of Kapha Shota, we have got Mandaruja. So that means Mandata is though because of the Kapha, that Ruja is because of the Vata dosha. That means the Kapha is dominant there, but Vata is also involved. So there are many such diseases wherein the patient will be complaining of pain. So if our aim is to treat that particular pain, then we should definitely think of treating the Vata dosha there. Again, we have got different varieties of pain explained in our classics in different granthas. It may be the Brihatrayas or the Laghutrayas, like Ruk, Shula, Todha, Bedha, Bhanga, Pida, Vedana, Arti, Avamarda, etc. So though they are considered synonymous, that means they are synonyms for the pain, they have got some slight difference in their meaning. Ruk is Satata Ruja. It's a continuous pain. Shula, the patient feels the pain as if he is being pricked by a Trishula. Toda is pricking type of pain. The needles, as if he is pricked by the needle. Suchi. Bheda, that is a breaking type of pain. Bhanga is something like that of crushing type of pain. So Pida, squeezing type of pain. Or Avamarda, that is a squeezing marda type of pain. So different explanations are there for different varieties of pain. So we get different usage of these words in a different context, especially in Vata Vyadhi itself. That is in Vataja Nanatma Vikaras. He has mentioned Padashula, Shiroruk, even Shirashula word is there, Gudarti, even Shula word is used in some of the contexts. Parshvava Marda, Parshashula is also there. Vakshastoda, Katigraha, even Katishula is mentioned. Grivastamba or Grivashula is there. Gradrasi, Chakrapani clearly says Gradrasi Shabdena Gradrasi Shulam Grahyate. That is, Gradra is a disease wherein Shula is the main complaint. The patient will be complaining of the pain radiating from the back to the limbs. So, though the word is used in a different way, the patient will have one thing in common, that is pain. In some places, it will be like Shula, in some places, it will be like Ruk. In Parshva, etc., it is like Avamarda or squeezing type of pain. So, we also have got different cutting type of pain, pricking type of pain, breaking type of pain. So, every explanation is there in even the modern books. So, when we go through the commentary of the same, that is Ashiti Vata Vikara, he says, Atra kasyajidangasya padadehe shuladeyo abhihita na hastadenam tatra ye abhihitahate pradhana bhutaha prayo bhavitvena hastadena. That means, though in the previous slide, it has been mentioned Padashula, Shiroruk, Gudarti, Parshvavamarda, Vakshastoda, etc. It doesn't mean that only Pada will be getting the Shula, only the Shiras will be getting the Ruk, only the Parshva will be having the Avamarda. So these are the most common sites of our body which are having such a type of pains. Shula in Pada Pradesha, Ruk in Shiras, Avamarda in Parshva, Graha in Kati, Stambha in Griva. So in other areas also, like Hastadi, he says, Ye abhihitahate pradhana bhutaha prayo bhavitvena. So whatever that has been mentioned, like Padashula, Gudarti, etc., Parshavamarda, etc., they are pradhana bhutaha prayo bhavite. In those areas, these varieties of pain are commonly experienced by the individual. So in other parts of the body, like Hasta, Amsa, Karna, Akshi, Nasa. So in other parts of the body also, we can have such type of pains. It may be the Shula, it may be the Ruk, it may be the Arti, it may be the Avamarda or Stamba or Graha. So they are only for the identification. Even if you go through the Charaka Samhita in the context of Ashiti Vata Vikaraha, they are the Prakrishtatama. It doesn't restrict the number actually. Prakrishtatama in the sense, again, it is these 80 diseases or the Vikaras are most commonly seen in the patients. So there are many other Vataja conditions other than these 80. Similarly, the Pittaja and Kaphaja Nanatmaja Vikaras, they are the 40 and 20 most commonly seen in the or frequently seen in the individual. There are many other Pittaja and Kaphaja Nanatmaja Vyadhis. So these are the Vikaras that are seen in the context of Ashiti Vata Vikara. So in different parts of our classics, we get different varieties of pain also, or usage of different words synonymous with the pain, like Anga Banga. There is a crushing type of pain all over the body. Pida Hradayasya. That is in the Rudroga. There is a mentioning in Charaka Sutra. Kyanta Shirasi Adhyaya. Then Hridi Vedana. So if you go through the Murcha, such a type of explanation we are going to get. So Vedana word, the Bhanga, the Pida, they are not used in the Ashiti Vata Vikara. But these are all varieties of pains which are seen in different other disease conditions. So as I have told earlier, Nahi Vata Adrite Ruja. Nasti Vatat Vina Shulam. That is Vatat Vina Shulam Nasti. Without Vata, there is no pain. So how this Vata will be causing the pain? So we have got the gunas of Vata. Tatra ruksho lagushyetaha karaha sukshmas chalo anilaha. In Charaka Sutra 12th chapter, he has added one more word under the gunas of Vata as Daruna. So how this will be causing the pain? Tatra ruksho. So what happens when there is Vata Vriddhi? So as per the Amsha Kalpana or the Vikalpa Samprapti. So one or the other qualities of a dosha is going to increase. It may be a one quality, it may be two qualities, three or any qualities. So depending upon that particular quality, the patient will be developing a different sort of a symptom. So Vata Vriddhi occurs or Vata Prakopa occurs. So that Vata Vriddhi, it may be due to increase in the Ruksha Guna, or it may be increase in the Chala Guna, it may be increase in the Vishada Guna, it may be increase in the Khara Guna or Sukshma Guna or any. So what happens when there is an increase in the Ruksha? So when Rukshata increases, so we have got diseases like Vipadika, Padadari, etc. Vipadika, Panipadasputanam, Tivra Vedanam. So when Rukshata increases too much, the patient will have, in a disease like Vipadika, Panipadasputanam, a break in the continuity of the skin or the tissues, leading to pain. The patient will be having severe pain in case of Vipadika. See, the Rukshata got increased. So again, cracks over the sole. Again, one of the most common complaint by the Vata Prakriti Purushas or the Vata Prakriti people, especially during the winter season, if they do not protect themselves, either with the usage of the Sneha Dravyas or not covering their feet with the shoes. Their shoes will be exposed to the dust, the weather, which is usually dry during the winter season. So Lokapurusha Samya Siddhanta, when there is an increase in the dryness or the Rukshata in the nature, naturally that will be affecting the body. The person will also have an increase in the Rukshata in the Sharira. So when Rukshata increases, Vata is also going to get increased. So Rukshata when increases, naturally Sneha or Snigdhata is decreasing. So there will be cracking of the feet Vipadika or Padadari as per Sushruta. So such explanation we can get in the modern science also, something like that, the psoriatic patches. The patient will complain of pain in such conditions. So Rukshaguna, when increases, can lead to pain. Next is the Shita Guna. Though Shita is not directly linked with the manifestation of the pain, but Shita will definitely increase the pain. Shita will definitely increase the pain. In case of Sama conditions of Vata. So Shitata, it may be the Ahara, that is Shita Guna Yukta, Shita Viryukta Ahara Sevana, or it may be Vihara, exposure to cold weather or the cold environment, as in case of winter season. Or the cold season, like even during the rainy season also, when the atmosphere is cold. What happens? The pain will increase. So we can see such type of presentation in a patient of rheumatoid arthritis, where in other season, the patient will not be having much pain, but the same gets increased during the winter season, or when the atmosphere is cold, or when the surrounding is cold. So in this way, Shita will also help lead to increase in the pain or causation of pain. Then comes the Khara or Daruna or Kathina. So if you go through the Charaka Sutra 12th chapter, Daruna is one of the qualities mentioned by Acharya Charaka, and Chakrapani had commented. Daruna means because of decrease in the Sneha, there is an increase leading to Kathinata, the hard. So such type of Dharunata can be observed in case of residual hemiplegia or Parkinsonism, or in case of frozen shoulder, wherein the patient will be complaining of pain during the movement. During rest, he may not have that much of pain, but when he moves his affected part, body part, or the limb, the patient will be complaining of pain. So again, Loko Purusha Samya, anything which is hard, if tried to move, or which is fixed, if tried to move, so it becomes very difficult to move. As we are having the life activity, the patient will be complaining of pain if the body part, affected body part is moved. So that is because of the Dharunatva or the Kathinatva. That is mainly because of the increase in the Khara Guna of the Vata dosha. Then, as Vata is Sukshma, it can, and moreover it is an Amurtha, it can reach different parts of the body within a short time of period. So in Sutrasthana 12th chapter, in Vatakalakali Adhyaya itself of Charaka Samhita, Pavanam Atibalam Atiparusham Atishigrakarinam Atyaikam Atishigrakarina. That is mainly because of its Sukshma Guna, as it has the tendency of moving through even the minutest part of the body or through the minutest srotas of the body. It spreads very quickly. So as you know, Pitta Pangu, Kapha Pangu, Pangavo Maladatava, Vayuna Yatra Niyante. So it is the Vata dosha that will be taking away all the other doshas to different parts. So fast spreading of pain or radiating type of pain can be related to Sukshma Guna of the Vata dosha. So as in case of Gradrasi, Spik Purva Kati Parshva Prishta, etc. he says. That means the patient starts in the Spik Pradesha, then it will be moving through Parshva, Kati, Prishta, then Janu, Janga, Pada. Reaches the foot or feet. So there will be movement of pain from one part of the body to the other part. Then the classification of pain based on its type as well as based on the parts that are involved. So based on type, as I told earlier, there is Ruk, Shula, Toda, Beda. Even in the modern science, we have got The pains like a continuous pain, the throbbing type of pain, the cutting type of pain, splitting type of pain, crushing type of pain, radiating type of pain, pricking type of pain, tearing type of pain, squeezing type of pain, and many such other varieties. This is what Ayurveda has also told. Ruk, Shula, Toda, Bheda, Bhanga, Pida, Vedana, Arti, Avamarda, Adi. So why so many words have been used? We could have mentioned only one word, Shula. See, whatever the lakshanas that are given in our classics, it may be Charaka Samhita, it may be Sushruta Samhita, it may be the Ashtanga. All samhitas are clinical. If you cleanly observe the lakshanas of the diseases that are given there, are mainly based on the history taking part. Whatever the patient has complained, similar words have been used over there. Patient says chimichimayanam, it's a tingling sensation. Actually, there is no any such word in Sanskrit that is with the root word. But these are the words of the patient. Patient feels as if he is having some, he says that jum jum. Many such words have been used in the classics, especially in the symptoms. Tudyate iva, bhidyata iva, pidyata iva. So tudyata iva, toda, pricking type of pain. So this is what the patient has told. I feel as if I am being pricked, tudyata iva. So this is for the sake of physician, so that he can plan the treatment in a far better way. Whether it is a continuous pain, whether it is a recurrent pain, or it's a throbbing type of pain, or bhanga, cutting type of pain, so something like that, other varieties. So these are based on the type. Coming to the parts that are involved, as I have mentioned earlier, Padashula, Shiroruk, Gudarti, Parshvavamarda, Vakshastoda, Katigraha, Grivastamba, etc. So which can be seen in different modern disease conditions explained, like a diabetic neuropathy, gouty arthritis, sinusitis, etc. Sciatica, when the migraine or the lumbago. So different varieties of parts are involved. So that is also seen in our Ghatavata or Sthitavata Lakshana. So can you see this?
Yes, sir.
Okay. So when we go through the Vata Vyadhi, he says, Tatra Koshtashrite Dushte Nigraho Mutra Varchasuho Bradna Hridrog Gulmarsha Parshashulam Cha Marute. So in Koshtagata Vata, Parshashula is there, caused by the Vata. Sarvanga Kupite Vate Gatra Spurana Bhanjane Vedanabihi Paritascha Sputantiva Asya Sandhayaha. In Sarvanga Gata Vata, there is Vedanabihi Parita. The patient will be having Vedanabi, that means there are different varieties of pains. Not only either the Ruk or Toda or Veda. The patient may complain of Ruk in one part of the body, may complain of Shula in other part of the body, or he may complain of Toda in another part of the body. So Vedanabi, the plural has been used. Similarly, Sputanti Iva Asya Sandhaya. See here, the symptom has been told as if the joints are breaking. This is what the patient has told. In the words of the patient has been mentioned here or written here by the Acharya. So that is if the Vata is Sarvangagata. Similarly, Gudastite, if the Vata is localized or migrated to the Guda area, then there will be Graho Vinmutra Vatanam Shula. There also the Shula is there. Then Hrinnabi Parshvodara Ruk, Krishna Udgara, Visuchikaha. So these are the Lakshanas, the Shula or the Ruk, Hrit Ruk, Nabi Ruk, Parshva Ruk, Udara Ruk. Then Visuchika, if Vata has gone to the Amashaya. Pakvashayasto Antarkojam, Shula Atopau Karoti. If Vata has gone to the Pakvashaya or the other parts of the Pakvashaya or Ashrita there, then that will be causing the Shula there. Along with that, there is also Kritramutra Purishatva Manaham Trika Vedanam. Trika Vedana is also there in the Pakvashayastha Vata. Then, in case of Twakstita Gata or Twakstita Vata, Twakstita means the Rasagata Vata, the patient will have Twagruksha Sputita Sukta Krisha Krishnacha Tudyate Todanavat Pida. Then Atanyate Saragacha Parvaruk, if it is the Rasagata Vata. Then Raktagata Vata Rujahati Vraha. Mamsamedogata Vata Tudyate Atyartam. Atyartam Tudyate. The patient will complain of severe pricking type of pain. Or else Dandamushti Hatam Tatha. As if he is hit by the stick or by the fist. Saruk. Shramitam Atyartam. And on doing physical activity, the patient will complain of some sort of a pain. These are Mamsamedogata Vata Lakshana. Then Asti Majjagata, Majja Asti Kupite, Bedo Asti Parvanam Bhedaha, Bedanavat Pida. Then Sandhi Shulam, pain in the joints. Then Santata Ruk, continuous pain. So these are seen in Asti Majjagata Vata. Then in case of Siragata Vata, Mandaruk, the patient will complain of mild pain. Of course, in Snayugata also there are different conditions like Bahirayama, Antarayama, Khalli, etc. So in those conditions also there are pain, though he has not mentioned it directly here. Then in Sandhigate Vate, Sandhigate Anile, he says, Prasarana Akunchanayoho Pravrittischa Savedana. While moving the limbs, especially the extension and the flexion, the patient will complain of pain in the Sandhigata Vata. So, Ityuktam Sthana Bedena, he has told, Vayoho Lakshanam. So, in different places of the body, it may be the Kosta, it may be the Amasha, it may be the Pakvasha, it may be the Rasa, Rakta, Mamsa, Sira. When Vata, Prakupita Vata goes there, that will be causing pain. See here in almost all cases, the patient is having the pain. In some places it is at Ruk, in some it is at Shula, in some it is Toda, in some it has Ruja. So different varieties of pain have been explained in these conditions. So this is nothing but Sthanagata Vata Lakshana or the parts involved. Then when we go through the Srotas, so Vata, as it is moving all over the body, definitely it will be moving in different Srotas, Annamaha, Udakava, Mamsava, etc. There also, wherever it reaches, in the Vruddha or Prakupita condition, this Vata will be causing one or the other disease with Shula as one of the major complaint or major symptom. So, Visuchika, Suchi Virivanistoda. The patient will be complaining of severe pricking type of pain. It's a Koshtagata Vyadhi occurring due to Ama Pradosha, Charaka Vimanasthana, second chapter. Visuchika and Alasaka, which are considered under Ama Pradosha Vikaras. So, in Visuchika, Suchi Viravagathrani, the patient will be complaining of pain, pricking type of pain, as if he is being pricked by the needles. So, that pain is felt by the patient all over the body. Similarly, in Charaka Chikitsa 5th chapter, there is the Gulma Chikitsita Adhyaya. The patient will be complaining of Hrit Shula, Nabi Shula, Udara Shula, etc. That is Shula in the Hridaya Pradesha, the chest, Shula in the Nabhi Pradesh, the umbilical region, Shula in the Udara, the abdominal region. Again, when we go through the modern science, we have got different diseases with the pain as the main feature. So most of them, so I have mentioned a few like polycystitis, pancreatitis, appendicitis, etc. The inflammatory condition again. So any inflammation or any inflammatory condition will have 4 features, and pain is one among them. There is temperature, redness, pain. So out of main symptoms, pain is one of the symptoms in any of the inflammatory condition. So in Annama Srotas, the Vata when aggravated will be causing different diseases with the Shula as one of the main Lakshana. Similarly, in case of Rasavaha and Pranamaha Srotas, in Pranamaha Srotas also, if you go through the Charaka Vimana Sthana, 5th chapter, Sroto Vimana, while explaining the Pranamaha Sroto Dushti Lakshana, he says, Sashulam Uchvasantam. The patient while breathing will have pain in case of Pranamaha Sroto Dushti. And if we consider the Pranamaha Srotogata Vyadi, Hridaya is the Moola of Pranamaha Srotas as well as Rasavaha Srotas. So when we go through the Vataja Hridroga or the Krimija Hridroga, so in Vataja Hridroga, there is pain. The patient complains of pain. In Krimija Hridroga also the patient will be complaining of pain. Again, angina, which we usually correlate with the Vataja Hridroga condition, and subacute endocarditis is usually related with the correlated with the Krimija Hridroga. So Pranamaha Srotas and Rasavaha Srotas, when afflicted with the Prakupita Vata or the Vruddha Vata or the aggravated Vata, will have disease condition with the pain main feature. Mutravaha Srotas, again Basti is the main part there. So Ashmari is one of the main disease coming under the Mutravaha Srotas or is affecting the Mutravaha Srotas. Again, renal calculi, and the main feature the patient complains in case of renal calculi or the Ashmara is the Shula, pain. Then Purishava Srotas, you have got different disease conditions related to Guda like Arshas, Bagandhara, etc. So in these diseases also the pain is the main feature, hemorrhoids or the pile mass or fissure in ano or the fistula in tail. So in both fissure or in fistula, so there is an opening or a break in the skin or the other tissues. So whenever there is a tear in the skin or the underlying tissue, definitely the patient will be complaining of pain, whichever may be the body part. Then Raktava Srotas, Kushtavi Sarpapidaka, Raktapittamasrigdaraha, Pliha, Gulmu, Atavidradhi. There are many other. I didn't want to stress upon the other factors. Nilika, Kamala, Vyangaha, Piplava, Tilakal, etc. have been mentioned. So he has mentioned Kushta, he has mentioned Pliha, he has mentioned Gulmu. So in Kushta, so there are 7 Mahakushta and 11 Kshudra Kushta. So the first 5 of the Kshudra Kushta are Vata Kafatmaka. The next 5 are Pitta Kafatmaka, and the last one is Kapha dominant, that is Vichastika. So in Vata Kafatmaka Kushta, again there comes the Vipadika, that is Vipadika Panipada Sputanam Tivra Vedanam. So again the Raktava Srotas, when afflicted with the Vata dosha, the patient will have the pain as main feature. The Pliha, so when we go through the Charaka Sutra 17th chapter, that is Trishotiya Adhyaya. So here we have got Vataha Plihana Muddhuya Kupito Yasya Tishtati Shanaihi Paritudan Parshvam Pliha Tasyabi Vartate. So Pliha Roga is actually the enlargement of the spleen, what we usually consider. So in that particular disease condition, pliha roga, vata plihana muddhuya, the vata will be displacing the pliha from its site, causing parshvam shanaihi paritudan, mild pricking type of pain, or causing pricking type of pain slowly in the flanks, in the sides of the body. Maybe the spleen is being displaced towards that part of the body, that is to the left flank. So the patient will be complaining of pain very slowly. So again, it comes under Raktava Srotogata Vyadhi. Then he has told Pliha Gulmo Atha Vidratihi, Gulma. See, in the Trishoti Adhyaya itself, he has told Yasya Vayuh Pragupito Gulmastane Avatistate Shopham Sashulam Janayan Gulmaha Tasyopajayati. So here also the Gulma is one of the disease which is caused by the Vata dosha, and the main feature in the Gulma is again the Shula. Then in case of Rohini, one of the considered as one of the Asadhya Vyadhi, of course, if not treated within 3 days, patient will die definitely. So Vata Pitta Kafayasya Yugapati Kupitaha Treha Jiffa Mule Avatishtante Vidahantaha Samuchritaha Janeyanti Brasham Shotam Vedanascha Pratak Vidaha. Here also the patient will complain of different Pratak Vidaha, different varieties of pains. And this is called Rohini, which Shigra Karinam. It occurs very quickly, and if not treated as an emergency, definitely that will lead to the death of the patient within 3 nights. So in Raktagata Vyadhi, or the Raktava Srotos Dushti, again there are diseases wherein the patient will have Shula as the main Lakshana. Then the Mamsava Srotas, Adimamsar Budam Keelam. So what Chakravani says is Keelam means Arshas here. Keela Shabdenatra Arsha Uchyate. Again, Arsha is nothing but the Adhimamsa Vikara. In Arshas also, Shula is the Pradhana Lakshana. Whichever Arsha we take, we consider Shula is one of the main feature there. Then in case of Astiva Srotas, he has clearly told Dantasti Bheda Shulam. The patient will be complaining of pain in the teeth as well as in the bones or in the bony part of the body. Majjavaha Srotas, Rukkuparvanam. The patient will complain of pain in the joints. And in Shukrava Srotas, Yasya Vayuh Pragupitaha Shopha Shula Karascharan Vangshanatu Vrashanam Yati Vradhi Tatsyopajayati. This is called Vridhi, wherein the patient will complain of pain radiating from Vankshana to the Vrashana, from the either waist or the low back to the Vrashana, the testicles. Shopaha Shula Karascharan. The patient is radiating, it is moving from Vankshana to the Vrashana. And that is again because of the Vata dosha there. So why I consider this? Because under the Shukrava Srotas, because Vrashana is the Mula of the Shukrava Srotas. So in short, Vata will produce Shula or pain when it gets aggravated or when it is in the Vruddha Avastha or in the Prakupita Avastha, circulating in different parts of the body due to its Sukshma Guna, in different Srotas, beginning from Rasa, Rakta, Mamsa, everywhere. And whatever the disease it is going to cause in these Srotas, so Shula is one of the main Lakshana there. So in this way, Vata is going to cause pain in different parts of the body. So the relation between Agni and the Vata. So when we go through the Charaka Vimanasthana second chapter, he says, Tatra Vataha Shulanaha Angavarda Mukashosha Parshva Prishta Katigraha. It should be Stambha, not Satamba. Stambhana Ani Karot. See, Ama, when gets associated with Vata, the patient will complain of different sorts of pain and discomfort, like Shula, like Angamarda, like a Parshvagraha, Prishtagraha, Katigraha, that is a stiffness in the Parshva, the flanks, the back, the waist, and Stamba. The movement is affected there. So, how the Ama is formed? Because of the Agrimandya. So, whenever there is Agrimandya, that leads to formation of Ama. And when this Ama comes into contact or it is combines with any of the dosha, so the actions of the doshas get affected. So these are nothing but the Vata when associated with the Ama will be causing such type of lakshanas. Again, here also Shula is there, Angamarda is there, Parshvagraha, Prishtagraha, Katigraha. So any movement in such conditions will cause pain or the Stambha. So here also Agni is having an indirect link with the Shula there. So they are related with the diagnostic part. So coming to the treatment part. So what is the chikitsa for all such types of pains? So in Ayurveda, we have got Samanya Siddhanta and Vishesha Siddhanta. So when we go through Sushruta Chikitsa Sthana 33rd chapter, he says, Kshinaha Brahmaitavyaha Prakupitaha Prashamitavyaha Vruddhaha Nirhartavyaha Samaparipalya iti Siddhantaha. This is the line of, this is the principle of treatment. What is the principle? He says, Kshinaha Brahmaitavyaha. The Kshina doshas should be Brahmaitavyaha, should be increased. Prakupitaha Prashamitavyaha. Slightly aggravated doshas should be treated by Shamana. Vruddhaha Nirhartavyaha. Highly aggravated doshas to be treated by Nirharana, that is Shodhana. And Samaparipalya. The doshas which are in the Samya Avastha should be maintained. This is Siddhant. This is the Chikitsa Siddhant. That is, Kshina doshas should be increased. Increased in the sense, they are brought to the normal condition. Only up to that stage, we have to increase, not more than that. Prakupitaha Prashamitavyaha. Prakupita doshas should be treated by Shamana. They should be subsided there itself. Vruddhaha Nirhartavyaha. Highly aggravated doshas should be thrown out of the body by Vamana Virechana, Nasya or by Vasti. Then Samaha Paripalyaha. That is, doshas which are in the balanced state should be maintained. So this is the Siddhanta, Chikitsa Siddhanta, what Ayurveda is following. The same has been mentioned in Charaka Sutrasthana 9th chapter. So how we have to maintain the balance, how we have to increase the decreased doshas, and how we have to reduce the increased doshas. So for the terms Sushruta has told, Prakupitaha Prashamitavyaha Vruddhaha Nirhartavyaha. So pain is nothing but an aggravated Vata condition. Once the Vata gets aggravated, there will be pain. Similarly, in Charaka also, we get the Chikitsa Siddhanta in the Sutrasthana 9th chapter. He says, Kshamam Akshamena Krisham Durbalam Apyaya Yamaha Shita Vibhutam Ushnena Mula Viparyayena Upacharantaha. So Kshamam Akshamena. Kshama means, so Akshama means Nirdravatva. Sorry, Kshama means Nirdravatva. That is nothing but Dravatva is not there. So when there is no Dravatva, there will be the rukshata. It is something like that of a dehydrated condition. So akshamena kshamam. Kshamam akshamena upacharantaha. Shitabhibhutam ushnena upacharantaha. So I have mentioned only these. There are many others. Krisham durbalam apyaya yamaha. Krisha and durbala is mainly because of the vata vriddhi condition. In vata vriddhi he says karshya karshni ushnakamitva kampanaha shakrit grahan bhala nidra indriya bhramsha. Karshya. Then bala bhramsha. Karshya krisham bala bhramsha durbalam. They are nothing but the vata vriddhi lakshanas. So such individuals should be apyaya yamaha. They should be treated with the brahmana chikitsa. So what we use usually in brahmana chikitsa, we usually use snigdha guna yukta, guru guna yukta dravyas, which will help in controlling the, and madura amla lavana rasa yukta dravyas, which will help in controlling the vata dosha. Similarly, shita vibhutam ushnena ushna vibhutam shitya. So shita vibhutam ushnena, the diseases that are mainly caused because of the increased shita guna or shitata should be treated with the ushna chikitsa. We have got svedana, which again helps in controlling the vata dosha. So in general, he says in the end, mula viparyayana upacharantaha. Mula viparyaya, mula is the karana. Karana viparya. So whatever is the cause, which is the cause for such condition, such type of presentation by the patient. So its opposite treatment should be planned there. If the condition of the patient is because of the rukshata, then its viparya, snigdha chikitsa has to be adopted. If a condition of the patient is because of ushna guna, then shita chikitsa should be adopted. So in this way, mula viparyayena upacharantaha, we should control the vata dosha here. So pain should be controlled. So that pain may be either due to ruksha guna, it may be due to dharana or khara guna, it may be due to shita guna, it may be due to chala guna. So we have to first analyze the property of the vata dosha, which has led to the particular condition. Then as per that, we have to plan the treatment. So the Vishesha Siddhanta, what we should adopt. If it is ruksha, then snigdha chikitsa. If it is shita, then ushna. If it is chala, then stira. If it is dharana and katina, then mrudu. If it is khara and parusha, then shlakshna. See, I give only few examples here. As I mentioned earlier, I don't want to go into details of the yogas. I will go only through the references that have been given in the classics. So you all are wise, or you have got enough intelligence to identify yourself the cause of the patient's condition, especially the pain in this particular case, and you can plan the treatment as per your intelligence or diagnosis. So in Charaka Sutra 20th chapter, while explaining the treatment aspect, Vata Upakrama, Tatra Maduramla Lavana Snigdhoshnaihi. Of course, the shloka goes very long. So that has been told in the Ashtanga in the 13th chapter, as the same has been given there in the Charaka. Snehana, Swedana, Mrudu Shodana, Abhyanga, Mardana, Veshtana, Seka, that is Parisheka, then Deepana, Pachana, Basti. So these are the different lines of treatment which have to be adopted to control the vata or treat the vata dosha. Of course, depending upon the extent of the vata prakopa or the vriddhi that has occurred, we have to plan the treatment. It is not that we should give all this treatment to the patient in case of vata roga. That is, patient should be given snehana, swedana, shodana, abhyanga, mardana, veshtana, seka, deepana, pachana, basti. No. We have to decide whether only snehana and swedana are sufficient, whether Abhyanga is sufficient, whether Mardana is sufficient, or Deepana Pachana is sufficient, that has to be decided by we people. Another thing, in which particular stage of the disease, which type of Vata Upakrama should be planned, like Snehana, Swedana, in which state of the disease, the Mardana or Veshtana or Deepana or Pachana. So that again has to be decided by the physicians. So the first one, Snehana and Swedana. So what is Snehana? Snehanam Sneha Vishyandamardava Kleda Karakam. Charaka has told in the Sutrasthana. Snehana is one which causes Sneha, increases Snigdata in the body. It causes the Vishyandana, it causes the Mruduta, Mardava, and it causes the Kledata. So what are the properties of Snehana Dravya? In that chapter itself, he has given Dravam Sukshmam Saram Snigdham Pichilam Gurushitalam Prayo Mandam Mruduchayat Dravyam Tat Snehanam Matam. So out of these, about 50% of the Snehana Dravyas have the qualities opposite to that of the Vata dosha. Like Drava, Snigdha, Pichila, Guru, Manda, Mrudu, etc. So Guru can counteract the Lagu Guna of the Vata dosha. Manda can counteract the Tikshna, or Mrudu can counteract the Khatinata or the Dharuna or Parusha. So because of the Dharuna, only the Khatinata occurs there. Due to Snigdha, it can counteract the Rukshata. Drava, again Drava is what? It is the quality of the Jala Mahabhuta, and any Drava will have the Sneha Guna. Some liquids will have more Sneha, some will have less Sneha. That's all. Then Sukshma, Sneha Dravyas, Sukshma. Again, that may help in the Dravyas to reach. If you consider Tila Taila, it is Ushna in nature. Tila Taila. So, it is subsiding Kapha, but it is not going to increase the, it is a subsiding Vata dosha, but at the same time, it is not going to increase the Kapha there. This is what Charaka has told in the Sneha Vidyadhyaya. So similarly, the air and the Taila, its Sneha Guna is different when you compare to Tila. The Snigdhata is, or Pichilata is more in that. So which type of Sneha has to be used? That has to be decided by the physician. Then the Swedana, Stambha Gaurava Shitagnam, Swedanam Swedakarakam. Stambhagnam, Shitagnam. So Swedana is useful or beneficial when there is an increase in the Shitata of the body. So which may lead to the Vata Prakopa. Thereby we can control the Vata there. So in the same chapter again he says Ushnam Tikshnam Saram Snigdham Ruksham Sukshmam Dravam Stiram Dravyam Guruchayat Prayaha Tadhi Swedana Muchyate. So Swedana is Dravyas are usually having Prayaha. That is, most of the Swedana Dravyas have Ushna Guna, Tikshna Guna, Saras, Snigdha, Ruksha, Sukshma, Drava, Stira, and Guru Guna. Out of these, again, here also Ushna will help in counteract the Shitata of the Vata. Then Snigdhata, because there are Ruksha Sweda and Snigdha Sweda. Snigdha will help in controlling the Rukshata of the Vata. Then Stira Guna is also there, that can help in counteract the Chalatva of the Vata. Guru can counteract the Laguta. So in this way, Swedana will help in controlling the Vata dosha. Then he has told the Mrudu Shodhana there. Tikshna Shodhana is usually not advised in case of Vata dominant conditions. So Mrudu refers to Alpa Virya Yukta, or else the Mrudu Guna Yukta. If we consider Mrudu Guna Yukta, Mrudu Guna is again mainly having the Jala and Akash Mahabhuta, especially the Jala. And if you consider the Drava Jala Mahabhuta, then Dravatva and Snigdhatva are the properties of Jala Mahabhuta. So this will also help in counteract the Vata condition. So if Tikshna Shodhana is given, so in which condition Shodhana is given? In the Prabhuta Dosha Avastha. So if Tikshna Shodhana is given in Vata Prakopa condition, see in Vata Prakopa conditions or the Vata Vritti condition, already the patient is having the Karshyata, already the patient is having the Daurbalya, and if we administer Tikshna Shodhana, the patient will not tolerate the effect of that Tikshna Dravya. Then his Karshyata and Daurbalya or Balabhramsha will further increase. So the purpose of administering the Shodhana will not be served. That is why he says Mrudu Shodhana should be administered there. Then coming to the Abhyanga. So he says Snehana, Svetana, Mrudu Shodhana, Abhyanga. So it's quite natural. Usually in Abhyanga, Sneha Dravyas are used. If you go through the Vata Vyadhi, he says Sarpi, Taila, Sarpi, Vasa, Majja. All the 4 Snehas can be used in different conditions. So main qualities in these 4 is nothing but the Snigdhugana, which will counteract the Rukshata of the Vata. Coming to the Sheka, Deepana and Pachana, Parisheka, Deepana and Pachana, which are considered under the Vata Upakrama. Again, Deepana, Pachana and Parisheka, all the Dravyas are having the Shita Guna, sorry, Ushna Guna, which will counteract the Shitata of the Vata dosha. So Deepana, Pachana will also help in the Ama conditions. So that I will go later. So Mardana and Vestana, which have been considered in the Vata Upakrama. That is Mardana, though it generally means a squeezing, we have to consider here Mardan refers to application of the pressure over a particular part of the body. So maybe we might have helped our grandmother or the grandfather or grandparents. So they might have had some type of pain in their calf. So when we were young, they used to call people and we were pressing their legs. It's nothing but the Mardana. So that will help in relieving the pain there. So that may be because of when they will have such type of pain, usually because of excessive activity throughout the day. So that is nothing but chalatva of the Vata is increased. So that chalatva has caused the pain, and by doing the Mardana, we are trying to control the chalatva of the Vata. The same thing is in case of Vestana. So all these Vata Upakrama we can get in the management of Gulma Chikitsa. See in the Gulma Chikitsita Adhyaya. Here he has told, 1 minute. Ruksha Vyayamajam Gulmam Vatikam Tivra Vedanam Bhaddavin Marutam Snehe Aditah Samupacharit. Snehana is mentioned. Bhojana Abhyanjanehi Panehi Niruhaihi Sanuvasanehi. The Basti, which is mentioned in the last of the Vatasya Upakrama. So it is also mentioned in the management. Snigdhasya Vishija Swedaha Kartavyo Gulma Shante. Swedana is also mentioned. So by the Snehana Swedana Niruha with the Anuvasana, he says Srotasam Mardhavam Kritva Jitva Martamulbanam Bitva Vibantam Snigdasya Swedo Gulmam Apohit. So this Snehana Swedana will help in the Sroto Mardava and controls the Prakupita Vata. Then as per the sthana of the Gulma, again different Vata Upakramas have been told. That is Snehapanam Hitam Gulme Visheshena Urdhva Nabije. If the Gulma is present above the Nabi Pradesha, then Snehapana is better. Snehana means it may be Snehapana, Sneha Abhyanga, Sneha Anuvasana. Then here Snehapana is mentioned. Pakwashaya Gate Bastihi. If the Gulma is in the Pakwashaya, then Basti is the line of treatment. Again, Vatasya Upakrama. Ubhayam Jatarashra. If the Gulma is in the Jatara Pradesha, both Snehapana and Basti are indicated. And once the Agni is increased in Gulma, especially the Vataja Gulma, Deepte Agno Vatike Gulme, Vibande Anila Varchasoho. Patient should be administered to Brahmana Annapana, which are Snigdha and Ushna in nature. See, Brahmana are usually Guru in nature. So he has specified Snigdoshnani Brahmanani Annapanani. The Brahmana Anna and Brahmana Pana, which are Snigdha and Ushna in nature, should be adopted. So Snehana, Svedana, Vamana, Basti, then both Niruha and Anuvasana Basti, all these have been told. Then here in the end, he says, in the treatment of Kaphaja Gulma, of course, Gulma is mainly because of the Vata dosha. So in Kaphaja Gulma, management of Kaphaja Gulma, Bandhana and there is Veshtana and Mardana has been also told there. See, 1 minute. Vamanam Vamanarahaya Pradhadyata Kaphagalmine, Snigdasvinna Shariraya, Gulme Shaitile Magate. Once the Gulma becomes a Shitila by Snehan and Svedana, Pariveshtana, Veshtana. The abdomen or the area of the Gulma should be tied. So that is to control the Vata again, the movement of Vata. Then here, Vimarga Ajapada Adarshai Yatalabam Prapide, Mridniyat Gulmam. Again, the Mardana of the Gulma Pradesh should be done. So all these treatments are mainly to control the Vata dosha there. Then where in the different conditions these Vata Upakrama can be seen. So in almost all Vata Vyadhis, Snehan and Svedana have been explained, that everybody knows. In Pakshagata and Ekanga Vata, specifically the Abhyanga is told, wherein the Snigdhata and Mriduguna is the main. So Mriduta will help in controlling the Dharunata or the Kharata, which is causing Katinata. Then Snigdhata will help in controlling the Rukshata. Then Snehapana. Snehapana is there. That is either Taila or Digrata. Pincharaka Chikitsa. Kushta. Vatottareshu Sarpihi. Vamanam Shleshmottareshu Kushteshu. The Sarpi is having both Snigdha and Lakshana Guna. So in Vata dominant Kushtas, Sarpipana is ideal. This is what Charaka says. So Vata dominant Kushtas. What are the Lakshanas of Vata dominant Kushta? He says Raukshyam, Shoshaha Todaha Shulam. See, Shula is there, Toda is there, Rukshata is there. If that Rukshata is controlled by the Snigdhata, then Parushya is there, Kharabhava is there. So that can be contracted by the Lakshanata of the Sarpi. So these might have caused the Toda and Shula. So the Sarpipana will definitely help because of its Snigdhata and the Lakshanata, which will counteract the properties of Ruksha and Khara or Parusha of the Vata dosha. Then Shita and Ushna Chikitsa. So in case of Ama Pradosha Vikara, in the Charaka Vimana second chapter, it has been told. Visuchika and Alasaka condition. So Deepana and Pachana should be the line of treatment. The purpose of giving Deepana and Pachana is to digest the Ama, increase the Agni, so again, that will also help in digesting the Ama and increasing the, at the same time, because of its Ushnata, that will also help in counteract the or reduce the effect of the Vata there. So this Ushna will help in counteract or control the Shetata of the Vata. Then Veshtana and Bandhana, Mardana, which are told under Vata Upakram. So when we go through the Bhagna Chikitsa, when we go through the Udara Chikitsa, when we go through the Gulma Chikitsa, in Sushruta, in Bhagna Chikitsa, he says, Saptahat, Ata Saptahat, Saumyeshu Rutushu Bandhanam. That is, Veshtana should be done. So this will help to control the Chalatva of the Vata dosha. So this is by Sthira property. Parisheka, Here also it has been told. That is avagaha is nothing but one of the form of a sweda there. Parisheka is also there. In Arshas Chikitsa, it is told. Nadya va asya aharet swedam shayanasya rujapaham ushnodake avagahyo va tata shamyati vedan. Doing the avagaha sweda. It will help in reducing the pain. Vedana shamyati or rujapaham. Similarly, in case of Ashmari, Uddrita Shalyam to Ushnodaka Dronyam avagahya swede. In the next he says that will help in controlling the pain there. Then, in the management of Bhagna, Sushruta has told, Nyagrodadi Kashayam to Sushitam Parishechane, Panchamuli Vipakvam to Kshiram Kuryat Savedan. In the case of Bhagna, where the patient is complaining of pain, when there is an association of the Pitta dosha, the Parisheka should be done with the Nyagrodadi Kashayam that is made cool. That's why Sushitam. And if the patient is having the pain wherein Vata is involved, Panchamuli Kashaya, that is a Kshira Siddha, Kashaya Siddha Kshira. So that has to be, that has to be used there. So Parisheka, Avagaha, Bandhana, Veshtana, Mardhana, which are used in the Vata Upakrama, have been explained in different disease conditions. Of course, there are many more. I am giving only a bit of that. And we have got different explanations in the Charaka Samhita. In Charaka Sutra 4th chapter, that is Shad Virechana Shatashritiya Adhyaya. We have got Angamardha Prashamana. We have got Shula Prashamana. We have got Vedana Sthapana. All are related with the pain. There are drugs which are controlling the Angamardha, like Vidari Gandha, Prishniparani, Brihati, Kantakarika, Eranda, Kakoli, Chandana, Ushira, Ela, Muduka, Dashemani, Angamardha Prashamana. Similarly, Shula Prashamana, Pippali, Mula Chavya Chitraka, Sangavera, Maricha, Jamoda, Ajaganda, Ajaji, Gandirani. And we have got Shala, Katapala, Kadamba, Padmaka, Tumba, Mocharasa, Shirisha, Vanjula, Elavaluka, Ashoka, iti Dashemani, Vedanasta. So some of the drugs act on the Agni, like Pippali, Mula, Chavya Chitraka, etc. So maybe the pain which has been caused by the Ama, and some are acting here Vedana Sthapana, again based on the Agni only, like we have got here different varieties, or in case of Atisara also because of Agni Mandya, in Vata Atisara the patient is complaining of pain, so we have got different drugs like Mocharasa, etc., which will help in controlling. We have got the Ashoka here. So then Vidari Gandha, Prishniparani, Brihati, Kantakarika, etc. Chandana, Ushira, Ela, Madhuka, etc. So some of the drugs are having Shita Virya here. Some of the drugs are having the Snigdha Guna. Some have the Vatahara properties. Here Vidari Gandha, etc. Prishniparani, Brihati, Kantakari. So Dashamula, it's Vata Kapha Shamaka in nature. So they will help in controlling the Vata dosha. So, though the patient will complain of pain, he will have different varieties like Angamardha or Shula or Vedana or Ruk or Bheda or Angabanga. So, it is left to we people. It is left to we people which type of pain the patient is having, and accordingly we have to decide. So it again, the planning the treatment or treating the or giving the medicine is depending upon the availability and the affordability, both. So in the end, I would like to quote what Acharya Charaka has told. Tasmat dosha aushadhadini pariksha dasha tattvataha kuryat chikitsitam prajnona yogaihi eva kevala. So this is nothing but the quote which I explained earlier. Acharya Charak has told, dosha aushadhadini parikshya, observing the dosha and aushadha and the other factors. Prajno, a wise physician should do the chikitsa. Na yogaihi eva kevalam, not only by the yogas that are explained in the Charaka Samhita. So with this, I would like to conclude. Thank you.
Thank you, sir. It was really an amazing session. We shall now go ahead to the question and answer session. Shall we begin, sir?
Yes, no problem.
Delegates can post their questions in the chat box. Sir, there is a raising hand.
Pardon? Your voice is breaking. Yes, Dr. Ritika Manjula.
Dr.
evening, sir.
Ritika, sorry.
Yeah. Good evening, sir.
Good evening.
Yeah, it was a nice session. Thank you.
Okay, thank you. Thank you.
Sir, usage of Agada Dravyas in pain management. As per my clinical experience, Kupilu Bija Kshira Paka works wonderfully in synovial inflammation, especially in the knee joints.
Okay.
So, your comment on that, sir.
Because I have not used the Kupilu Dravya in my clinical practice so far. But the one thing what I have observed, though I have not used it myself, I have observed in some of the patients in my hospitals, we have used Kupilu Taila,
Okay.
which was a folklore preparation.
Oh,
So they used to treat the vranas, where the patient was complaining of severe pain and in the joint pains also.
okay.
So Kupilu Taila is being used. Of course, Kupilu being Ushna, etc., Tikshna, etc. So definitely might act on the Vata dosha. That may be the reason behind that one. So as such, I have not used the Kupilu in my clinical practice. Of course, we have got Agnitundi, etc., wherein the Kupilu is one of the Dravya there. So other than that, so Kupilu as such individually, there is as a single drug or as a Pradhana Dravya, I have not used it so far.
Yes, sir. It acts wonderfully, sir. It's Bija Kshirapaka, actually.
Okay, okay, very good, very good.
Where like allopathic treatment failed, when they approached us, Kshirapaka worked wonderfully, sir. Thank you, sir. Just an information.
Kupilu Taila is also working in the same way. Of course, it was
Okay.
a folklore practice.
Okay.
So on the ulcers, it gives a very good result. It heals the ulcer in a very short time. So that I have observed in some of the patients in our hospital. Long back, of course, that preparation is now not being done. That's a different issue. But otherwise, Kupilu is having wonderful result.
Thank you so much, sir.
Next question. How did the Kriya acts on Asti Pradosh Vikara?
Voice is breaking. Hello.
Sir, how Tikta Kshira Basti acts on Asti Pradosha Vikaras?
Pardon? Again, the voice is breaking.
Sorry for the inconvenience, sir. Sir, the question is, sir, how Tikta Shira Basti acts on Asti Pradosha Vikara, sir?
Tikta Kshira Basti
Acts on Asti Pradosha Vikara, sir.
Tikta Kshira Basti.
Yes, sir.
Okay, okay. There is what the Asti Pradosha Vikara and the management of Hastigata Vyadis. So there is what even the classicals have told. So of course, I have not used much of this, but because I am practicing only in the clinic, I have not practiced Panchakarma so far. But Tikta Kshira Basti, as there is an explanation in the Ashtanga Hridaya, that is under the, while he explains about the concept of this Ashray Ashray. So it has been told Asti Marati Yohanaivam, and in the same context, the Brahmana should be the line of treatment. That is Tikta Kshira Basti. Of course, the Basti is to control Vata dosha, and the Kshira, so to control the effect of the counteract the that Vata Prakopa condition also, because of its Madhura Rasa, Snigdha Guna, etc. Maybe in that way it is helping. I have, of course, here also Tikta Kshira Basti, even in our hospital, I have not seen much of its usage here in Astigata conditions. So other conditions like Kshara Basti, then Balavarnakara Basti, so all such Bastis I have observed, but such a type of Bastis I have not come across so far. Please excuse me for that.
Thank you, sir. Question is, what should be used in Tivra Arsha Shula? What should be used in Tivra Arsha Shula?
Tivra?
Arsha Shula, sir.
Arshas.
Sir.
So we here in our hospital, one of the main prescription what we use here in case of Arshas is usage of Triphala, Gugula and the Gandhaka Rasayan. So Gugulu, though it is not considered directly under any of the Shula Prashamana drugs in classics, it acts wonderfully in the pain. So what is the rationality, how it works? Again, it is a bit difficult how the Triphala Gugulu, maybe Triphala is doing the Vatan Lomana, etc. That may be the reason. But otherwise, the Triphala Gugulu and the usage of Gandhaka Rasayan. So one of the common prescription in the Shalya department in our hospital is Triphala Gugula and the Gandhaka Rasayan. It gives a relief of pain within a very short time. The patient, even I have used it in my clinic also, of course, along with the Manibhadra Guda. So that helps in controlling the pain very quickly. I have seen the patient saying that the pain is relieved much for about 70 to 80% by 3 or 4 days. So this is what I have used in my clinical practice. Even in our hospital, also Triphala Gugula and Gandhaka Rasayan is the main prescription in case of the Arshas. So when we have such a wonderful combination, we have not gone for the other preparations. Somebody may have some other experience, that's I don't know, but we have a very good combination here, that is Triphala Gugula and the Gandhaka Rasayan.
Okay, sir. Thank you, sir. The next question is there any relationship with pain and ama, especially in digestive system?
Yes, we have got classical explanation of ama pradosha vikara in alasaka and visuchika. Visuchika is that where the patient is having the complaint of pain, suchi virivagatrani vidyati visuchika, and that is mainly because of the formation of ama. So when the ama gets associated with the vata dosha, the patient is complaining of pain. Even in samavata condition, as explained in the Ashtanga Sangraha, the patient will be having the pain or the ruja, which is increasing during the cold season or when this atmosphere is cloudy.
Please.
So that will be causing the pain in the individual. So ama is having a link with the pain. So when the ama associates with the vata, the patient will definitely have some sort of pain. Either it may be, of course, it may not be the ruk always, it may not be the toda always. But ama is having a link or a connection with the vata dosha and the pain. So accordingly, we have to plan the treatment. That's all.
Thank you, sir. Next question is, can you throw some light on yoni vedana, dysmenorrhea? Which vata guna might be responsible for that? Is matra basti works good on that? Yes.
I don't have any experience of treating such conditions, but the matra basti is definitely having a role in most of the shula conditions. I have observed the patients complaining of pain in the back, low back. They have taken the matra basti for months together, and they are relieved of their backache, which was disturbing them for years together, by the month-long treatment of matra basti. So maybe that sneha, which is used in the matra basti or the anuvasana basti, is definitely going to help the patient there. So here also in yoni vedana, it definitely might help, because of course I don't know in what way this matra basti will be of use. We have got pichu, etc., yoni pichu, etc., using the sneha yukta dravyas, etc. So definitely that snigdha might help in controlling the yoni vedana. Of course, if we go through the classics, yoni shula is mainly because of the vata dosha there. In the sneha vidya, they have the charaka samhita also. In the indications of snehas, this yoni shula is one among them. So definitely matra basti should be of help in such conditions.
Thank you, sir. Moving on to the next question. Can you throw some light on ama chikitsa, sir?
Ama chikitsa in the sense, so we have got deepana and pachana. So when these deepana pachana dravyas are used, so definitely the ama gets digested. The patient who is having any condition or the problem with the ama will be relieved of that. So we use here a chitrakadivati, we use agritundivati. So the patient who is not having hunger, having some sort of joint pains, mild body ache, etc., they are being treated with the chitrakasava, or even the amrutottara kashaya, or chitrakadivati, even the agnitundivati. So being ushna and tikshna, so they definitely help in the digestion of the ama. They do the ama pachana and agni dipana. Thereby they are brought under control.
Thank you, sir. Next question is, internally, how to use Kupilu Kshirapaga and what will be its dose?
See, I have told earlier, we have not used Kupilu as such. So Dr. Ritika Manjula is the one who has used the Kupilu Kshirapaga, if I am not wrong. Am I right, madam? So how to use? I think it is better to consult with the madam itself, because as I have not used the Kupilu internally, it is as a single drug. So it is better to interact with the madam itself. I'm sorry for that.
Okay, sir. Thank you, sir. Next question is, Ashukari Chikitsa for pain management.
Pardon?
Sir, Ashukari Chikitsa for pain management.
See, that depends upon the type of pain. So I think it's Ashukari in the sense the treatment which will relieve the pain immediately, right? I think so. Am I right? Whether it was the intention of the person, whether it is the, in that sense, the person has asked the question, or I think so.
I think it's
Emergency in the condition. That's what I told. We can control the pain within a short type of period. So that depends what type of the pain the patient is complaining, patient is having. So if the pain is severe and if it is because of the bugna or the fractures, the only thing is we have to keep the fractured area in place and not allow it to move. That is the only idea, that only that can be done. And if the patient is having, as asked earlier, the pain in the pile mass or the arshas, again we have got the tripala gugula and the gandhakarasana. Severe pain, the abdominal pain. So whether it's due to ajirana or due to ama or due to anaha, the distension of the abdomen, so that depends. So ajamoda works wonder in sometimes. So I have used a drug which is wherein the ajamoda is one of the main drug, wherein so if the patient is having some sort of ajirana or agni-mandya or a distension of the abdomen, in that condition, giving ajamoda, of course there is a patent medicine wherein the ajamoda is the pradhana dravya. So that drug, when given 3 tablets, when given, the patient will be relieved of the pain in the abdomen or a fullness of the abdomen within an hour. The patient will get the belching repeatedly, and during the belching, udgara, the patient will have the smell of the ajamoda itself. So ajamoda acts in some of the conditions, and I have used even the lashunadivati in the distension of the abdomen with the pain, wherein the consumption of the lashunadivati will help in relieving the distension that allows the flatus to pass and the pain of the patient gets relieved. So that depends. So within a short time, within a half an hour or within an hour, I have seen the patient getting the relief in some of such conditions. So that depends upon the type of pain, the cause of the pain, and which type of pain, whether it is the distension of the abdomen that has led to the pain or due to any other conditions. Even sometimes the burning pain, they will be relieved by the application of the ghrata. So it depends on the variety of pain and the cause of the pain.
Thank you, sir. Next question is, in Katishula, Shamana or Panchakati is better, sir?
Pardon? In Katibasti, sorry, Katishula?
Shamanam or Kativasti, Panchakarma therapy is better.
Voice is breaking. Katibasti is?
In Kativasti, Shamanam or Panchakarma therapy is better, sir?
Its voice is breaking, madam.
Sorry, sir. Sorry for the inconvenience, sir. Sir, in Kadishula Shamana, is Panchakarma Kadivasti better, sir?
See, actually, Katibasti doesn't come under the Panchakarma.
Sorry, sir. The question is, in Kadishula Shamana, is Kadishula Shamana or Panchakarma Kadivasti, which is better, sir?
In Katishula?
Sir, the question is like that. Is Kadishula Shamana or Panchakarma Kadivasti, which is better, sir?
Katishula Shamana in the sense, I didn't understand that particular part.
I'm sorry, sir. The question is like that, sir.
See, in Katishula Shamana, Katibasti is better, of course. But Katibasti doesn't come under the Panchakarma as such.
Okay, sir.
Okay.
Okay, sir. Thank you so much, sir. So the next question is, what should be used in muscular pain after exercise or excess work, sir?
The first thing after exercise, see, we have to see that we should not get body ache. What exercise has been told, Vyayama has been told that Ardha Shaktya Nishevyastu. We should do the exercise till we get sweating over the forehead, etc. So that indicates, so if we do more than that, definitely we will be having the Vata Prakopa. So as I told earlier, Mardana is one of the treatment. There also in classics also they have told Mardana should be one of the treatment, body ache. So then of course, if the pain doesn't subside, we have different yogas there. So in such conditions, Trayodashanga Gugulu has helped. I have used Trayodashanga Gugulu in such body ache conditions. It has given good results. So I have hardly received any complaint from the patient when used Trayodashanga Gugulu. The patient has hardly told that their pain has not reduced. Only 2 or 3 patients might not have got result. Otherwise, the Trayodashanga Gugulu is having a wonderful result in such body ache conditions, mild body ache. In such conditions, Trayodashanga Gugulu had given a very good result.
Thank you so much, sir. Sir, the next question is, what to do in case of acute dental pain, sir?
Again, that's a very difficult question to answer, because even the such patient when came to clinic, maybe because as I am practicing near to the city, I have always referred such patients to the dentist. In certain conditions, I have used this lavanga, clove oil. Of course, that has given the result, but the patient had come with the complaint again the next day. That's a different issue. Maybe the cause of the pain, dental pain, may be something else. So at once the clove oil, application of clove oil, we have to take a small cotton piece, soak it in clove oil, then keep that cotton piece in the area where the patient is having the pain. So it will give the result. That means it relieves the pain within 15 to 20 minutes. For 1 or 2 hours, the patient will not be having any pain. But of course, after that, gradually the pain starts. So at once, the pain can be relieved by using the clove oil. If clove oil is not available, we can ask the patient to take a clove, small clove, and keep it between the teeth. And if possible, the patient can crush that, or else he can tightly hold the clove oil between his teeth. Definitely that gives a result that helps in relieving the pain.
Thank you so much, sir. So the next question is, in case of renal colic, treatment yoga, sir.
In renal colic?
Treatment yogas.
Treatment yogas. That means the yogas.
Yes, sir.
Again, the classical medicines I have used, of course, I got only 1 case so far of renal calculi. Of course, we ask the patient to take plenty of water, plenty of coconut water. I have used the Gokshuradi Kada, and in some cases, Gokshuradi Gugulu. So Gokshuradi Kada, of course, might not have given, it has not given that much of result. Maybe because the size is bigger. So I didn't get the 100% result in that particular case. So it is better to, so I have not used such type of, I have not come across with such type of patients much in my clinical practice. So we have got some patent medicines. They are saying that it is very good, but I don't know, because whatever the patient had come, I usually prescribe the classical medicines. Of course, the renal patients or the renal calculi, I have received only 1 so far. So of course, in that patient, I didn't get the 100% result.
Thank you so much, sir. So the next question is, What medicine will be best given in joint pain, sir?
That it depends. I have got Yogaraja Guggulu. I have got Mahayogaraja Guggulu. I have Trayodashanga Guggulu. I have Yosha the Gutika. I have Chandra Prabhavati. I have Navajivana Rasa. So I have Gandharva Hastadi Kashayam. I have Balapunar Navadi Kashayam. So we have different yogas here. Personally, I have used Gokshuradi Guggulu. I cannot say the rationality behind that, because I don't know whether how many will agree with this, but personally, I have used this Gokshuradi Guggulu and it had given the result. Maybe Gokshura being one of the Dashamula will control the Vata and Kapha, that we can say. But otherwise, we have got Mahayogaraja Guggulu, we have got Yogaraja Guggulu. But more than the Yogaraja and Mahayogaraja Guggulu, I got result in the Gokshuradi Guggulu. So anybody can try. I don't know, but I have got the result with the Gokshuradi Guggulu. Even of course the Navajivana Rasa is having a good effect in the joint pain conditions. That will also help in relieving the joint pain. Of course, it acts within a short time of period. Or even the Gandharva Hastadi Kashayam, that will also help in relieving the joint pain within a short time of period. So combination of Navajivana Rasa and the Gandharva Hastadi had given a good result in joint pain also. So that I have seen and observed. I have used it in quite a few cases also. But again, that depends upon the type of pain or the patient complaining. If this is mild, then you may opt for Yogaraja or Mahayogaraja, and it may, if it is somewhat severe or the pain is more, then you can go for Navajivana and Gandharva Hastadi. But Gokshuradi had given a good result.
Thank you so much, sir. Sir, there is another question. So, which is the safe painkiller to be taken in pregnancy, sir?
Again, such type of, the pregnant ladies have not come to me so far with the complaining of such type of course. So whether it is, there is a fullness of the abdomen, there is a bloating, so we can go for something like that, Jirakadhyarishta, etc. That I have seen, I have observed. Though I have not given, I have come across with the pregnant ladies taking Jirakadhyarishta in the complaints like bloating of the abdomen leading to pain. So the Guggulu preparations usually are not prescribed as far as my knowledge is concerned. Of course, as I don't have that much of experience in such conditions, it is better to keep mum in that particular aspect.
Thank you so much, sir. Sir, the next question is, what is the dosage of Navajivana Gutika, sir?
So I usually give 2 tablets. So again, it depends upon the pharmaceutical company which it prepares. So I have got Navajivana Rasa prepared from a pharmacy by name Uma, which is from the Kasganj UP. They prepare good Rasaushadis. So usually 2 tablets thrice daily. And if the pain is not that severe, 2 tablets twice daily can be given, either only Navajivana Rasa or with the Gandharva Hastadi Kashayam. So definitely it is giving result. So the size of the tablet is of the amount of 1 Rati, it's 125 mg approximately.
Thank you so much, sir. So there is another question, sir. Sir, what about Shallaki in pain, sir?
Shallaki can also be given.
Okay,
So
sir.
some companies prepare Shallaki as a single drug in the form of capsule, etc. Shallaki is also having a good result in joint pain and in the backache. I have seen, have observed the patients. getting relief.
Thank you so much, sir. So there are no more questions, sir. Shall we conclude, sir?
Okay, no problem.
Thank you so much, sir. Thank you so much for patiently answering all the questions, sir.
Okay, thank you. I don't know to what extent you people have benefited from my talk. Anyhow, I should thank you people, DIKSHA E-Learning, Dr. Srividya and Dr. Drashya. And thank you very much for your patient hearing. Thank you.
Thank you so much, sir. Now, to deliver the vote of thanks, I would like to invite Dr. Anu, Assistant Professor, Department of Kriya Sharira, Ayurveda College, Coimbatore. Over to you, ma'am.
Good evening, everyone. On behalf of Ayurveda College, Coimbatore and Team Diksha, it is my privilege and a great joy for me to extend a vote of thanks for today's session. First of all, I would like to express my sincere gratitude to Dr. Srikant for sharing valuable knowledge about the topic pain management through Ayurveda. Thank you, sir. Thank you for this informative session.
Welcome. Thank you.
I extend my sincere gratitude to the whole Diksha team for providing us with the best virtual platform. Last but not least, let me thank all our delegates who have responded so well to our invitation and made it a grand success. We look forward to welcome you again in our coming sessions. Thank you, one and all.
Thank you.
Thank you so much, ma'am. With that, we have come to an end of today's session. To know all about our further updates, please do stay connected with us in our social media platforms. Once again, thank you, sir. Thank you all the participants for joining us today and hope to see you all in the upcoming sessions. Until then, stay home, stay safe. Thank you all. A very good night.